If it's true that the Lieutenant Governor Palacios, as other lieutenant governors may have done, signed the travel authorization for Governor Torres, that he too, Lieutenant Governor Arnold Palacios, be held in violation for approving that TA? Or is it just Ralph De Leon Guerrero Torres? Now that these...
All right, and now let's go into the KOM News Zoom room because our friend Shawn Gumataotao, always a member of the KOM family, the Link family, is back on common ground. And if you saw Shawn, welcome back to the 671 from your trip to the 670, as it were. And I saw on Facebook over the weekend you were posting some pictures. You had a nice weekend. Oops.
Hi, Shawn. Good morning.
Oh, there you are, guys. Good morning.
Yeah, good morning.
No, sorry, my bad. I have myself.
No worries.
I have myself muted.
So we wanted to bring Shawn on here to kind of unpack his trip over to the NMI, where you were assisting with the response to the surge that's happening in the Commonwealth of the Northern Mariana Islands. But Shawn, you were specifically on Saipan, no?
Yes, I was out there for just less than a week, and just, Chris, let me just say that for the first time, I hadn't been in the CNMI maybe in 10 years. Oh. And from what I could see, I think there's still challenges abound all across the entire island of Saipan, but not just Saipan, but also Tinian and Rota as well.
Well, Shawn, I know that you were here for the duration of our big Delta-driven surge this year, right? Where, I mean, it was, 12, 13. It was... I don't even like thinking about it. It takes me back to that place. But having been through that and then going to Saipan in the midst of their surge, how would you kind of compare and contrast the things going on there compared to what happened here?
Yeah, I would probably the most fairest assessment is to talk about contrast. I had a chance to go all around Saipan, and I actually ran into Tomas when we were we were there at the antigen testing that's being done by the fire department, or the Department of Fire and Emergency Services there. Had a chance to go down to the multipurpose center. I think the biggest contrast, Chris, would be the school-located vaccinations that are being held in the 20 public school system schools in the CNMI. And it was an absolute, first off, to just see how brave these young kids are that are 5 years old getting a shot, obviously to prevent themselves from getting COVID. And the PSS, and had a chance to speak to some of the administrators and parents. The kids were pretty funny because they knew what they were doing. They knew they were doing something very, very special and important. So I didn't doubt their motivations, but the school system absolutely has stepped forward. I mean, as soon as the CDC guidance was given, PSS went right to work with a lot of help from the Commonwealth Healthcare Corporation. And this morning, I think that we got to think about the amount of kudos that should be given to the CHCC and the leadership of the CEO, Esther Muña. As you just saw in the earlier report from Tomas, the opening of the COVID-19 Community Center, which I had a chance to go before they opened. There's a lot of work being done leading forward to be able to serve their community. And I just was blown away by the amount of support that it was given and the response of the community to get tested, to get vaccinated, to get boosted. Just an amazing scene in the CNMI. I think they're somewhere over the 90% now in terms of total vaccinations to date.
Shawn, I want to ask when you talk about contrast, right? So you're kind of talking up about the school-based vaccinations. And I think it's interesting because in the NMI, Esther Muña is the CEO of the Commonwealth Health Corporation, and that is run by its own board. So she kind of is independent of the administration, right? And they were able to stand up that school-based vaccination. I'm not sure how involved CHCC was in that, but on Guam, we had the chair of the Physicians Advisory Group kind of just punting it over to GDOE and saying, hey, GDOE needs to do this. They need to get vaccinations, while kind of like leaving public health out of that entire conversation. So why do you think, given that's a little bit of a different landscape with the CNMI's Public Health Authority and the administration, why do you think they were able to stand up those school-based vaccinations so quickly compared to where we're at, which is still basically on the drawing board?
Yeah. Let's. In all fairness to the Physicians Advisory Group, they had said, if you recall, they were very in favor of these tests, and Public health had also advised too. So it's not like they were coming out of nowhere with it. It was boiling down to the logistics to be able to pull off a school-located vaccination. Now, I will say this from the CNMI's point of view. When I went to the schools, I went to four different schools. They had a small team of school nurses. Okay, school nurses who I spoke to, who were former CC nurses, and kudos to them this morning. They were fully committed to being able to deliver the vaccinations. They had done it earlier when the vaccines first came out. They were asked to step up. There was a small team that followed each and every school nurse. The process, which was, again, just like Guam, in a sense that you got to get online, you got to make an appointment, you go to the school, you make an appointment. It was very seamless. The lines at the schools were impressive to see them waiting very patiently. And a lot of it, Chris, goes back to access, right? So if you're familiar with the geography of the CNMI, or at least in terms of Saipan, if like in an example, the first one was San Antonio in southern Saipan, that's kind of a distance from the multipurpose center in Susupi. So these people were walking, okay? They were walking to the vaccination site. They were not turning away local residents. I saw older folks, manamko, that were coming to get vaccinated because they just couldn't get there. The transportation was limited. So they opened their schools, they opened their hearts, they opened their entire program to their school communities. I think that is something that I was a witness to. They were very happy to be there. They were happy that the actual vaccinations came right to their school locations. And the administrators were very appreciative because for them, it was trying to get the entire school communities out there and vaccinated, especially in the elementary schools. I spent a lot of time at Garapan Elementary, and the school administrators there were, they were a little disappointed they couldn't get all of their 400 kids. They had, I think, about 100, but they're not closing the door to the other 300 kids. They're saying, okay, I'm going to get the first 100. They're going to get their second dose in 2 weeks. What is going to stop the other rest of the school community to come out and get that jab? And if they're not going to the clinics, if they're not going to their doctors, then it's right at their schools. And parents were there. In one case, Chris, I was at that. I think it was as it was at Chacha Ocean View Middle School. The kids were coming by themselves. They got the waivers from their parents. So these kids were coming in and they're already signed. The parents had already committed. And it was just great to see their commitment to get the vaccine. So it's not like parents are not being part of that process. In fact, they're part of the process. They were part of the process in the very beginning. I was on 2 calls with the CHCC's pediatrics chair, Dr. Sadie Laponzi. She spelled out exactly what the COVID vaccine would do and for the kids, how safe it was, and the messaging and all that. Yeah. And then the response was pretty quick across the entire CNMI and at least in Saipan, to get kids vaccinated.
Shawn, I want to talk about the messaging a little bit because, we've had our challenges with the messaging. And the NMI, though, it seems very well stripped down and consistent. Can you kind of go into that a little bit? What at least the observation from many, even across the federal partners, is that in terms of messaging, as they see, as the community has seen either an uptick, might have been a cluster of cases, or word of there might be some infection, the CNMI, the people there went out, got tested, they were getting vaccinated, they were getting boosted at higher levels than probably anywhere in the United States. So what does that mean for messaging? At times, I think they kind of beat themselves up going like, hey, is the message working? Trish and I my wife Trish and I were listening to Esther Muña, and it's about how much love do you have for your people? That very compassionate plea to get vaccinated, and it was on your air. She mentioned this, and people came out and were trying to protect one another. And I think that sometimes we think about the public health side of it all and how that can be lost in not just Guam, but in Hawaii and in other states. But at least in terms of what can be done locally, it's about getting, and I think they are getting the word out. It's just, how do we respond? How does our community respond
to the messaging. Get boosted, get vaccinated, get tested. Is that resonating right now, or do we have COVID fatigue? And I think studies are being done all across the country relative to COVID fatigue and how it's just taken over. And so it's really having an adverse impact, not only on our society, but also the components of it, our economy, our faiths. By the way, you guys missed Talafofo earlier. It's Talafofo, Father Danny, who used to be at Jigo.
Is
you
he
guys got to come down. But
he's in Talafofo? Father
he's
Daniel?
in Talafofo now, yeah.
Does he still do the PowerPoint?
Yeah, right. But Chris, going back, it's how faiths are impacted by COVID.
Yeah.
So all of these things are having a long-term and having ramifications today. And I think that's something we all have to look at pretty closely.
Sean, so how do we on Guam kind of like double back and just simplify everything? Because as it stands now, being a member of the media and a so-called media partner with, the Public Health Authority and the administration, I got to say, I'm not really clear on exactly what our message is. I know what it needs to be, but I'm not seeing it consistently communicated from the people on high.
Well, I guess in fairness, we do get a chance to hear from members of the Physicians Advisory Group. Former member, obviously, Dr. Wynn is very vocal, and he's been on KUAM quite often. But the Dr. of the world, Dr. Berg has his cameo once in a while on KUAM News, and he should be heard a lot more. But other members are being heard about. Dr. Ann Pobutsky, which has been absolutely a big voice in this as the territorial epidemiologist and the data. I think that it's all taking it all in. How do each and every one of your listeners this morning, myself included, how do we take that information from Dr. Ann and her team, and how do we live our lives moving forward? I'm always getting mad at my kids for touching stuff at the store. Do we go out to a movie? Do we, try to live life as much as normal as possible? Yeah. They are coming on our air, and I say ours, meaning the KUAM News Family's air, and they're talking about it. We as a society and a community have to continue to listen to them and continue to take those, I guess, words of advice, if you will, Chris and Jason, and use it to the best of our abilities in our own families and our friends. And I think that's all we can ask for today. And as we're getting into the new year, I'm hoping that we'll see more of them and more interaction between Guam Public Health and the administration to this air to help tell that story. Because there's a lot of things happening that are being said across different platforms all over the community. But this reach that KUAM has is very significant. And you're right, if you're a media partner, then they should, the partnership is not a one-way street. It really is collaborative, and it should be nurtured. And yeah, there's been some issues in the past. Let's get past that and let's move forward and how we can communicate best for our community, especially as we head into we're going into another year of a global pandemic.
Ooh. Thank you for your kind words, Sean. Appreciate it.
No, when I think about kindness, Chris, I know it's a Christmas time, but also it's about being just, hey man, from experience, I think we've all been there. I mean, someone the other day asked me, when you were doing it, I was like, seemed like 2 decades ago, but nothing has changed. Nothing has changed in our community, except we got our hair is a little more tsungi, Jason probably more than others. But the idea is it's changed. And so we have to respond so accordingly. And I think that our society is asking that of all of us today, especially our kids, especially our Manamko. They're asking us to kind of bury that hatchet and let's move ahead and let's do our best to serve all the people of Guam and the Marianas as best we can.
Amy comments in here, Sean, just to kind of end this convo, relative to the CNMI, she writes, they have a very solid community-supported effort. I think we could have had that if we had more community. So definitely agree, as this pandemic has left a lot of us divided, and I'm not so sure we'll ever be able to come back again after this. But thank you, Sean.
Thank you guys. And just a big plug for the podcast. I will be dropping an episode later in the week That's it. That's all. You can catch it on Spotify, Apple Podcasts, Stitcher. Again, that's it. That's all. It's a very proud member of the KOM podcast.
What's your episode
network.
on, my friend?
Believe it or not, it's Christmas in the Islands, and I'm not singing a song. So, but it's no. It's just a kind of a reflection of the season. It's kind of it's a little bit different than the average podcast and that we've had in the past. So I'm very excited about it. But it'll drop right around probably Christmas Eve. So
well, let's get. Well, we're off on Christmas Eve, but yeah, if you want to jump on Thursday, I'll shoot you a text. Hey, but just real quick, Sam Maggette.
Sure.
So Father Daniel is over in Talafofo. I kind of lost track of him.
Yeah, he started there recently when they moved Father Felix to St. Francis.
That's right.
And so it's been good. The village is getting ready for Christmas, and as Mayor Louise can attest, especially in her village, that all of the mayors are doing their darndest to prepare for Christmas. And we can't forget those guys, because those guys are also doing things. They're not being scared of what's happening with COVID. They want to celebrate the season and not be paralyzed by what could be this ongoing pandemic. And thanks to the mayors, my mayor especially, Mayor Ben Tadigui, and the village mayor staff for all that they do for all of us year round. So thank you to all of them. And again, thank you, KOM, for all that you guys do, especially this Christmas time.
And thanks, Shawn, for also bringing up Talafofo Parish, because I've actually been to when my Auntie Bobby's father passed away and everything. We went there, and it was the one of the rosaries leading up to the funeral. So it was around like 5:30 in the afternoon. And man, when you get the sun just starting to come there and it comes through the windows of the church, I mean, it's a beautiful sight. Very, very uplifting.
And by the way, the reason I go to Saturday 5 p.m. because the music ministry is good. Daniel Kinata, and there's a kid who has the same name as me, and my dad and my grandfather who sings in the choir. So I'm fully vested in that choir.
Hey, Shawn, does Father Daniel still do the acronyms? Because I remember when I was going up at where he was before, he would always do like Easter. The E is for evangelical. The A is for this, or you know what I mean?
This past Saturday was piety, was the word of the day. So yes. I was listening to the sermon this week.
Well, I like Father Felix because I go over to St. Francis, and I made this joke on Instagram the other day. It's like every sermon he's always got to start it with so anyway, a priest and a rabbi walk into a bar. I think it's always got a joke, always hits, always great. Thank you, Shawn.
Here's the jokes.
Yeah.
All right, guys. Hey, you guys. Hey, by the way, if I don't talk to you before Friday, Merry Christmas to all of you all, and Merry Christmas to the KOM family.
Merry Christmas, bro.
Thank you, Shawn. Merry Christmas, my man.
Merry Christmas, guys.
Okay, there you go. Shawn Gumataotao. That's it. That's all podcast. He'll be dropping an episode by Christmas Eve. It's a Christmas present. Okay. All right. We're gonna get with Mayor Louise right after the break. We are gonna take a break. The show is brought to you by Pacific Points, Calvo Enterprises, ITD, and Jack in the Box. On this, what kind of day is it out there? You know what kind of day is it out there? It's 3 days from Christmas Eve kind of day out there, guys. Okay, it's a beautiful day in the neighborhood. And we're coming back with Mayor Louise, who's just trying to make her village that much more beautiful. We'll tell you how and why coming up after the break. Miss a link, miss